The medical assistant is often responsible for performing ear irrigations in the medical office. An ear irrigation is the washing of the external auditory canal with a flowing solution. Ear irrigations are performed to cleanse the external auditory canal to remove cerumen, or earwax, discharge, or a foreign body. They can also relieve inflammation by applying an antiseptic solution. An ear irrigation should never be performed if the tympanic membrane is perforated, because this could result in a severe irritation or infection of the middle ear. Sanitize your hands before proceeding. Assemble your equipment. The equipment includes disposable gloves, the irrigating solution, the solution container, an irrigating syringe, an ear basin, a moisture-resistant towel, gauze pads, and an ear wick. You will need to check the label of the irrigating solution 3 times to ensure that you have the correct solution. The first time is when you remove the solution from the shelf. Check the irrigating solution carefully against the physician's instructions to make sure you have selected the correct solution. Warm the solution to body temperature, or about 98.6 degrees Fahrenheit. This is done by placing the solution container in a basin of warm water. Use a bath thermometer to make sure the water used to warm the solution does not exceed body temperature. If the solution is too hot or too cold, it might stimulate the inner ear and make the patient dizzy. Now, check the solution label a second time before pouring the solution. Palm the label of the container to prevent the solution from dripping on the label and obscuring it or loosening the label. Remove the cap of the container by touching only the outside of the cap and placing it on a flat surface with the open end up. This prevents contamination of the cap. Rinse the lip of the bottle by pouring a small amount of solution into a separate container. Pour the solution into the basin at a height of approximately 6 inches to reduce splashing. Replace the cap on the container without contaminating it and check the label a 3rd time before you return the container to its storage location. These multiple checks let you discover any mistake you may have made in choosing the correct solution. Greet the patient and introduce yourself.
Hello, Miss Dunaway.
Hi.
How are you today?
Doing good. How about you?
Wonderful.
Good.
Identify the patient and explain the procedure. Explain the purpose of performing the irrigation. For example, to remove cerumen or earwax. Tell the patient the procedure is not painful. However, she may feel a minimal amount of discomfort. Occasionally, the patient may experience a minimal amount of dizziness, fullness, and warmth as the ear solution comes in contact with the tympanic membrane. Help the patient into a sitting position and ask her to tilt her head toward the affected ear. Gravity encourages the solution to flow out of the ear and into the basin. Place a moisture-resistant towel on the patient's shoulder under the ear to be irrigated. The towel protects the patient's clothing and prevents water from running down the patient's neck. Instruct the patient to hold the ear basin tightly against her head under the affected ear to catch the irrigating solution. Apply your gloves. Clean the outer ear with a gauze pad that has been moistened with normal saline or the solution ordered for the irrigation. This removes any discharge or debris that may be present and keeps foreign particles from entering the ear canal during the irrigation. Fill the syringe with the irrigating solution, which is approximately 50 milliliters of solution. Expel air from the syringe. This avoids forcing air into the patient's ear, which can be uncomfortable for the patient. Straighten the external ear canal to permit the irrigating solution to reach all areas of the canal. If the patient is an adult or a child over the age of 3, gently pull the ear upward and backward. Pull downward and backward for children 3 years of age and younger. Insert the syringe tip into the ear, but not too deeply, as this could be uncomfortable for the patient. Make sure the tip of the syringe does not obstruct the canal opening so that the solution can flow freely out of the canal. Obstruction of the canal can cause pressure within the canal, resulting in patient discomfort and possible injury to the tympanic membrane. Inject the irrigating solution toward the roof of the ear canal. This angle lets the solution flow down the length of the canal and out the bottom. It also avoids the severe discomfort and dizziness that may occur if the solution is injected directly onto the tympanic membrane. Refill the syringe and continue irrigating until the desired results have been obtained or all the solution is used, depending upon the purpose of the irrigation. Observe the returning solution to note the material present, for example, cerumen, discharge, or a foreign object. Also note the amount such as small, moderate, or large. Dry the outside of the ear with a gauze pad. Ask the patient to lie on the right side on the treatment table to allow any remaining solution to drain out. Tell the patient that the ear will feel sensitive for a short time. Place a cotton wick loosely in the ear canal for 15 minutes if instructed to do so by the physician. This will make the ear feel less sensitive. Remove your gloves and sanitize your hands. Chart the procedure. Include the date and time, which ear was irrigated, the type, strength, and amount of solution used, the amount and type of material returned in the irrigating solution, any significant observations, and patient reactions. Use the correct abbreviation to indicate which ear was irrigated. The abbreviation for both ears is AU, for the right ear is AD, and for the left ear is AS.